I'm Sharon Courtney, and we're here with Jenine Dabon from the Tulane University Wellness Clinic. We're going to get some practical tips today for how to protect yourselves and your community from COVID-19. To start, let's talk about hand washing. It's all anybody can talk about. What do we need to know?
Hand washing is one of the best and easiest ways for you to help prevent the spread of this virus. Uh, One of the things people want to know is how long should I wash my hands? And so the current recommendation is that you wash your hands for at least 20 seconds. So how do you get through washing your hands for 20 seconds? Maybe think of the song Happy Birthday and sing the first verse of Happy Birthday.
Who can be infected and who is at risk for getting sick?
So, when we're talking about the coronavirus and who can be infected by the virus, many people, everyone is at risk. However, there are specific groups that we concern ourselves with, and that is folks, for example, that have lung disease, diabetes, or they are taking medication that potentially can compromise their immune system and makes their immune system weak. So we're concerned about those folks specifically. And with that in mind, if you are sick, you should really stay at home and stay out of the way of the healthy folks.
So if I'm not in a high risk category, is it safe to go out to the grocery store, to the park? What should I be doing?
Well, we want to kind of consider everyone and keeping everyone safe. So if you are in a low risk category, you want to think about, protecting yourself, practicing good hand washing, because if we protect the society, then what we're actually, in fact, doing is protecting or preventing the virus from spreading to others in the community.
What can we do to help slow the spread of the virus? How do we protect ourselves and others?
So, although you may not be considered high risk and you're in a low risk category, it still is important to think of the community that we are living in. And so, things that we enjoy doing, like going to large concerts, large festivals, Mardi Gras just happened, and we did have a lot of thousands of people in town. And so, you want to think about, okay, how can I best be a good participant in the community? And that's by avoiding participating in large events like that. And really, if you're sick, stay home.
What are some precautions we can take if we're around people who are at risk for getting seriously ill? And what are some precautions for those who are at increased risk that they can purge?
So the recommendations are constantly changing when it comes to what we consider large groups. So, we think about large events like when we have big festivals. So the current recommendation, however, is for 50 or less in a group. So sometimes we have a large business meeting, large conferences. Those are the things that, if you've noticed, they have started to be limited.
There's a lot of talk about what we can do to help curb this disease. What about things that we should not do?
So, on an individual basis, some of the things that we want to consider and we always are tempted to do is still try to make it to work when we're not feeling that well. So, really, at this point, if you are feeling sick in any way, you should try to stay at home. Absolutely practicing good hand washing, good hand hygiene, and just overall good hygiene. Like if you blow your nose, go wash your hands. If you touch your face, go wash your hands. And then also we go back to the social distancing. In our community, we love to be really close and congregate. Try to keep those in mind. And then as a community, we want to think about avoiding hosting large events, avoiding going to large conferences.
But since everybody else is, do I need to stock up on toilet paper?
There's really not a need or cause for us to go out and over purchase toilet paper. We need to be commonsensical about this and purchase just the items that we need for our home. We are having to stay at home a little bit more than usual. So think about, okay, I'm at home maybe every day instead of going into work. So just think about it in a common sense way.
I have a runny nose and I don't feel good. Do I need to go to the hospital and be tested?
A few things that you should avoid doing when thinking about trying to curb this disease is, so we talked about handshaking, hugging. Stay at home if you're sick. So if you're still having to go into work, stay at home if you know that you've developed a fever, you have a cough, those types of things. Staying away. Don't go around other folks who are at higher risk. So if you are in a situation where you have elderly that live in your home, folks that are over the age of 65, or you know that have some type of compromised condition, you may want to limit the contact with those folks. As well as one thing that has been really popular lately is you've been seeing a lot of folks go to the grocery store and hoard supplies and hoard food. And really we should think if we all just buy just what we need, then we'll have enough for everyone.
Can you explain why we've canceled events and closed schools, etc.? What does this do for us?
We're seeing a lot of cancellations of schools. We're seeing a lot of people staying at home from work. So what is that doing for us? What it's actually doing is helping us prevent, or better, for better lack of word, limit the spread of the virus. Because when we're all together and we're congregating, that gives us a big opportunity if somebody's coughing, if someone's sneezing, to spread the virus in a more rapid manner versus let's have everyone stay at home, let's have the kids stay at home, let's do distance work, distance learning, so that we're not putting everyone at risk. And as a community, that should start to help us limit the exposure of those in our community.
This isn't the last time you'll hear from us, and we want to know what questions you have. So please email us at medquestions@tulane.edu.